Ever wondered why you sometimes feel dizzy after a long walk on a sunny day? Or why your skin feels unusually dry? The culprit could be dehydration. Dehydration is a common yet often overlooked issue that can sneak up on anyone, anywhere. It occurs when the body loses more fluids than it takes in, leading to a deficit that impacts essential bodily functions. Think of your body like a reservoir. To function optimally, it needs to be replenished regularly. Without enough water, everything from your brain function to your digestive system starts to suffer. This condition isn't picky about its victims. From the bustling athletes sprinting on the track to the elderly couple gardening in their backyard, dehydration can affect all ages and lifestyles. It often springs up during situations where you might not realize you're losing water, like during intense exercise or on particularly hot days, or it can be a sneaky side effect of illnesses causing vomiting or diarrhea. Stay tuned as we dive deeper into the causes and symptoms of dehydration and why it's crucial to keep our bodies hydrated. Drinking less water is an obvious cause of dehydration, but what else triggers this condition? Let's delve into the myriad reasons why someone might become dehydrated, beyond just not reaching for that glass of water often enough. One of the most prevalent causes of dehydration is excessive sweating. During vigorous physical activities or on hot days, the body cools itself by sweating. This natural process, while essential for maintaining body temperature, can lead to significant fluid loss if those fluids aren't replenished. Athletes, outdoor workers, or anyone engaging in intense exercise are particularly at risk, especially if they do not hydrate adequately before, during, and after their activities. But the heat isn't the only environmental factor contributing to dehydration. Higher temperatures, common in summer months or in certain geographical regions, increase the body's need for water. It's not just about feeling thirsty. It's about the body's desperate need to maintain a normal temperature. Furthermore, illnesses play a significant role in fluid loss. Conditions that cause frequent vomiting or diarrhea can rapidly deplete the body's water and electrolytes. This is why staying hydrated is crucial when you're sick. Diseases such as gastroenteritis or even a severe cold that leads to a fever can increase the body's fluid requirements significantly. It's also important to highlight that certain groups are more vulnerable to dehydration. Young children and older adults often have a lower reserve of water. Young children because they have smaller bodies and higher metabolic rates, and older adults due to a decrease in body water as part of the aging process. Both groups might also have difficulty communicating their thirst or physically accessing adequate fluids. So, while it might seem straightforward to just drink water, the reality is that many factors contribute to dehydration. From environmental conditions and physical activity levels to health status and age, the risk factors are wide-ranging. Understanding these causes helps us prevent dehydration before it starts affecting our health. How do you know if you're dehydrated? It's not just about feeling thirsty. Dehydration is a bit like a stealthy, silent process that can creep up unexpectedly, affecting every cell in your body and indeed your overall health. Recognizing the early signs of dehydration can help you take prompt action and avoid more serious complications. For adults, the symptoms of dehydration are not always obvious. Initially, one might experience a dry or sticky mouth, a sign that the body needs more fluids. As dehydration progresses, other symptoms manifest, including tiredness or fatigue, even without exertion. Some might notice a decrease in urine output, with the urine being darker in color than usual. This is your body conserving water to maintain essential functions. Physical signs such as dizziness or lightheadedness are also common and can be particularly dangerous, especially if operating heavy machinery or driving. In severe cases, a person might experience confusion or fainting spells, indicating that the body's normal functioning is being compromised due to lack of fluids. Children and infants show different signs of dehydration. A very young child might have a dry mouth and tongue. Parents should look for signs like no tears when crying, which is a clear indicator of fluid deficiency. For infants, fewer wet diapers or dry diapers for 3 hours or more are warning signs that they are not getting enough fluids. Lethargy or irritability in children can also indicate dehydration and should not be overlooked. It's crucial to understand these signs and act quickly. Dehydration in children can escalate from mild to severe rapidly, and the younger the child, the more vulnerable they are to the adverse effects of dehydration. This can range from minor irritability and sluggishness to severe, life-threatening conditions like hypovolemic shock. Catching these symptoms early can be the key to preventing serious health issues. So whether it's for yourself or someone in your care, Staying alert to these signs can help maintain health and prevent the complications associated with dehydration. Dehydration does more than just make you thirsty. It impacts your entire body. Imagine your body as a bustling city with its complex networks and systems. Now think of water as the essential fuel that keeps everything running smoothly. Without enough water, just like a city without power, things start to malfunction. When dehydration sets in, it's not just about feeling dry, it's a series of cascading effects that compromise your health. Firstly, your brain feels the impact. Water is crucial for cognitive functions. Hydration levels directly influence mood, memory, and focus. A dehydrated brain has to work harder to accomplish the same tasks. It's akin to running a high-tech computer on a low battery. Efficiency drops and errors increase. Moving to the kidneys, these organs rely on adequate water to filter waste from your blood and expel it through urine. Lack of water leads to a higher concentration of waste, which can result in kidney stones, a painful condition where waste crystallizes in the kidneys. Moreover, a dehydrated environment is ripe for urinary tract infections, as the reduced urine flow gives bacteria a chance to settle and multiply instead of being flushed out. Additionally, consider the cardiovascular system. Blood is predominantly water, so dehydration decreases blood volume, making it thicker and more viscous. This means your heart must pump harder to circulate this sludgier blood through your vessels, which can lead to increased heart rate and blood pressure. Over time, this extra strain can wear out your cardiovascular system. Severe dehydration can push the body into extreme distress, leading to heat stroke, a serious condition where the body's temperature regulation fails. In high temperatures, without enough water to sweat, the body can't cool itself effectively, potentially causing damage to the brain and other vital organs. The ripple effect of dehydration is vast, affecting more than just your thirst levels. So, how can we effectively combat dehydration? While the simple answer might seem to be drink more water, there's a bit more to it than just that. Hydration is not solely about water intake, it's also about how we can retain and effectively use that water in our bodies. Let's talk about the types of fluids and foods that are particularly beneficial for staying hydrated. Beyond plain water, beverages like coconut water, herbal teas, and even broths can be excellent for hydration. These fluids often contain electrolytes like potassium and sodium, which are crucial for maintaining fluid balance within the body. Furthermore, consuming fruits and vegetables high in water content, such as cucumbers, tomatoes, oranges, and watermelons, can significantly boost your hydration levels. These foods not only supply water, but also come packed with vitamins and minerals that enhance the body's absorption and retention of water. Hydration strategies can vary significantly depending on the environment and the activities you're engaged in. For instance, if you're an athlete or someone who engages in regular physical exercise, it's vital to hydrate before, during, and after your workouts. Sports drinks that contain electrolytes can be particularly useful in these scenarios to replenish the minerals lost through sweat. In hot climates, it's essential to increase fluid intake to counteract the loss from excessive sweating. Wearing light clothing and staying indoors during peak heat times can also help minimize fluid loss. On the other hand, in cold environments, you might not feel as thirsty, but it's just as crucial to keep hydrated. Warm herbal teas and broths can be comforting and hydrating options when it's cold. Moreover, integrating hydration into your daily routine can be as simple as starting your day with a large glass of water, carrying a reusable water bottle throughout the day, and perhaps setting regular reminders to take a sip. It's also beneficial to reduce intake of diuretics like caffeine and alcohol, which can increase fluid loss. With the right strategies, staying hydrated can become a simple part of your everyday life. As we wrap up, remember that dehydration is a preventable condition that should not be taken lightly. Throughout our discussion, we've delved into the various causes of dehydration, ranging from intense physical activity and excessive heat to inadequate fluid intake. We've also highlighted the telltale symptoms to watch for, such as persistent thirst, dry mouth, fatigue, and dizziness. Understanding the severe impact dehydration can have on your body underscores the critical importance of maintaining fluid balance. It's not just about quenching thirst, it's about ensuring that every cell, tissue, and organ in your body functions optimally. To stay hydrated, don't wait until you feel thirsty. Make a habit of drinking fluids regularly throughout the day and include water-rich foods in your diet. By doing so, you're not only preventing dehydration, but also supporting your overall health and well-being. Keep yourself hydrated and you keep yourself healthy. Thank you for watching, and don't forget to like and subscribe for more insightful content.